Can you do me a favor? Can you look in the camera and say like, comment, and subscribe?
Like, comment.
Like, comment, and subscribe to my channel. So to my grandson's channel. Say like, comment, and subscribe to my grandson's channel.
Like, comment, and subscribe to my grandson's channel.
You heard it. All right. Thank you. Okay, so today I have my good friend Donna Lefevre. Donna and I worked together for quite a while. You were at GSK well before I was, but you and I worked together for the majority of the time that I was at GSK, I would say.
Yeah, we worked together for 5 or 6 years. Yeah.
I thought it was even longer than that.
Yeah, well, actually, we worked closely together for 5 or 6 years.
That's true. Yes. So you and I worked extremely closely together, so much so that we traveled the world together.
Yes.
We spent like weeks at a time together in other places, which is, from my perspective, and not to say that I'm some like God's gift or cakewalk to travel with, but a testament to you. We traveled for a very long time together away from our partners. And I used to joke all the time, like that, having a job like that, to have to travel with someone who you don't purposely choose to spend your time outside of work with can be a lot. But I was very lucky to be traveling with you. So we'll get to this, but rather than me rambling on, I would love to turn it over to you to tell me a little bit about yourself. Oh, I didn't even start. You're retired currently. Donna Lefevre. Maybe I said that, maybe I didn't. You're retired. Congratulations on a well-deserved retirement. I hope you're enjoying it. I know we'll get to that too. But I'll turn it over to you to tell a little bit about yourself and your roles over time.
Okay. Thanks, Anthony. And yeah, we had a great time traveling and working together. I feel so lucky to have spent that time with you.
Thank you.
And I'm sure we'll talk more about that, but thank you. So if you want to hear a little bit about my career before I retired, I wanted to be a nurse from the time I was a little girl. I always wanted to be a nurse. I wanted to relieve pain and suffering. I couldn't stand to see anyone in pain or suffering. And from the time I was a kid, I felt that being a nurse would be a good way to help people. Sounds very rose-colored glasses, but that's how I felt as a kid. And you know what? That's a gift to know what you want to do at a young age.
Absolutely.
Yeah, so I feel very fortunate, and that's been a great career for me. And unfortunately, while I was in nursing school, my pup-up, my grandfather, I called him my pup-up, he had been a policeman, and then he became a detective. And he was a very strong man, both physically, mentally, emotionally. People often compared him to like a John Wayne kind of a guy.
Okay.
That's how he was, both, protecting the community as a police officer and as a detective. And then he was very protective of his family. And me being his granddaughter, he spoiled me rotten, which was wonderful. But unfortunately, while I was in nursing school, he was in a car accident that resulted in him being paralyzed from the neck down. And you can imagine for anyone how devastating that would be, but particularly someone who his whole life was about protecting others. And now here he was, essentially completely dependent. And that was devastating for him and heartbreaking for all of us to see him in that situation. And that affected my career because when I graduated from nursing school, my first job, I elected to work in a spinal cord injury unit because I wanted to help people like him. And I saw what he went through and I saw what his family went through. So my very first job was I worked at McGee Rehab Hospital. It was a acute rehab facility, and I worked with spinal cord injured patients because I wanted to help people like him. So he inspired me even then. And that hospital also had a brain injury unit. They had a stroke unit. They had a unit for individuals with amputations. Eventually, in my 9 years there, I worked in all of the units. And they also had an outpatient unit where we would follow people for life. And the other thing I liked about rehab was that you got to work with a diverse group of professionals. It wasn't just nursing. We worked with doctors. We worked with physical therapists and psychologists and vocational therapists and horticultural therapists. And I really liked that everyone brought their skills together to do the best that we could to help those patients and their family members, get their life back and make the most of it. So that's why I did that. So that was my first career. I worked there for 9 years in various roles. And while I was working there, I went back to school at night to get my master's degree as a nurse practitioner. And also I had a dual major as a nurse practitioner and occupational health. And I liked a nurse practitioner because I found as a nurse, after I got some experience, there were things I knew that needed to be done, but I couldn't do them because I had to have a physician's order to do it. And usually you could get those, but it took time and
Hmm.
As a nurse practitioner, we can order our own lab tests, we can make diagnoses, we can prescribe medication and treatment. So I felt that I could help more in that capacity. And I liked occupational health because it really focused on prevention. And so if you can prevent injuries and illnesses from happening in the first place, no one suffers at all.
That's a little foreshadowing.
Yeah, yeah,
Yeah.
exactly.
Yeah,
A
yeah.
little foreshadowing for
Yeah.
what we did. And so I wanted to do that for that reason. So I got my nurse practitioner and Occ Health. And then my first job after I graduated was GSK, not initially when I worked with you. And I was interested in working for a pharmaceutical company because I really liked the diversity of the people I would work with. As you know, probably part of the reason why you chose it. It's an international company, most pharmaceutical companies. So you get to learn about different markets and cultures and countries. And
Hmm.
you're working with scientists and IT people and manufacturing people and administrative assistants and marketing people and, just a broad array of individuals, which I really liked. And I liked the preventive piece of it. And there was just a lot I liked about. So I wanted to work for a pharmaceutical company. And my first job was I was a team leader for our corporate headquarters. So I led a very small team. I'd had some management experience from the hospital. So I led a very small team at our corporate headquarters, helping everyone who worked at the corporate headquarters, did things like travel medicine consults and treated injuries and illnesses. But I wanted to use my clinical skills more. So fortunately, after about a year and a half of doing that, I became the nurse practitioner for multiple sites. I was able to work at two of our very large research and development sites. I was able to continue to work for our corporate headquarters. I was able to work for our data management site. And so I could do all kinds of things like travel medicine, take care of scientists, take care of the people who worked on the computers. I could treat injuries and illnesses, but we did all kinds of preventative programs as well. If a woman was pregnant, we would go, if she was a scientist, look at her work area and make sure that all the chemicals and whatever she was working with were safe, for her and for her baby and to keep everyone safe. So we did a lot of prevention. We ran health fairs where we would, run blood tests and help screen people for if they didn't know that they had an illness. We brought in nutritional counseling and we worked on a great program, which I know you worked on, which was the corporate athlete, which was really cutting edge and really very exciting, where we helped people to really identify what was their mission in life, right? What
Hmm.
is it really all about for you? And then we would tie nutrition, exercise, stress management. What is your why? This is why you should eat healthy and exercise, not to fit into this dress for the Christmas party, but because, right, whatever it is for you, so that you can be there for your kids or so that you can achieve your career goals or so that you can, go have fun and explore the country, whatever your why is, make that painting, write that book. And so I really liked that we taught that. So I did that for 16 years. And a lot of people say, well, you shouldn't stay in the same job for many years as a career. But for me, that worked because I always was learning new challenges and was really happy with what I did. And that worked for me. And I think there's nothing wrong with that if you're happy with what you're doing.
Agreed.
So I did that for 16 years. And then I had this once in a lifetime opportunity to work on the Partnership for Prevention program, which is where you and I worked closely together.
Hmm.
And that's where this was started by several people, but Dr. Bob Carr and Dr. Ron Joines come to mind for me.
Hmm.
I worked very closely. I know you interviewed Bob, and Dr. Ron Joines was one of my mentors who helped me a lot in my career. And they realized that globally, some of our employees who helped develop and manufacture vaccines or different treatments, they couldn't afford them for themselves or for their families based on the healthcare in their country. And so they came up with a plan that we're going to come up with an evidence base, that's very important, a set of preventative health care that will allow all of our employees and their family members to have access to preventative health care all over the globe. It doesn't matter where you live. It doesn't matter what your job level is. If you're at the top of the house or the lower level of the house, if you're in, the US or Morocco, it doesn't matter. You're going to have access to this set of opportunities for prevention. And that was very exciting to me. And that fit right into my value system. And I was fortunate enough to get on that team. And you were on that team when I joined. And I joined as a global health advisor. And so what we did was look at the pre-existing list of programs. And to give people an idea, the preventative health included things like vaccinations, screening for cancers that we knew early detection and treatment could result in a cure, screening and treatment for things like diabetes, high blood pressure, high cholesterol, HIV, because we know if you can catch them early and treat them, you can prevent other problems down the line, like stroke, heart attack, etc. Prenatal care, which is very important. We know moms and babies have better outcomes when they get good prenatal care. All of those wonderful things that we had the opportunity to make sure that all of our employees and their families globally had access. So as the global health advisor, part of my job was to understand what is currently in place. And what we did was a global health advisor and a global benefits advisor worked in partnership. And that partnership was very important. And on some of the countries, I was the health advisor, you were the benefits advisor. We worked great as a team, I think. I really enjoyed working with you. And what we would do was whatever country or region we were working with, we would work together to identify what's in place. We would do a gap analysis, what's not in place, and then how do we put this in place in a way that's sustainable. And so it gave us an opportunity to learn so much about healthcare in other countries. We learned so much and we met so many amazing people, right, all over the world. We got to travel, and most importantly, we got to put some preventative health care in place that wouldn't have been in place otherwise. And we may never know the people that we help, but it's great joy to me to know that people didn't get sick because of some of the things that we put in place. So that was just an amazing project, and
I agree.
You agree?
Yeah, I think one of the coolest things was that partnership. So when you first joined, I was doing something different on the project. I was doing the finance initially. I was still working on other international benefits programs, but I hadn't stepped into the benefits advisor role yet. And I think my first region, I was partner with you, right? Asia Pac was...
Yes.
Yeah, it was my first region. So it was really cool to be partnered with you. When you said that you learned a lot, one of the things, I think... I try not to, I won't talk too much on this because this is about you. I try not to make this about me. That project is one of the most rewarding things, not just in my career, that I've ever done, period. Because not only was I learning from you, like I could go into it, I understand how insurance policies work, and we could talk about negotiating certain things in and developing it a certain way so that we can allow coverage the way we want it. But actually understanding the types of services and what's written in there was so crucial to have you there and learn from you to make sure that we were covering both bases. But then on top of that, one of the other really cool things that I thought was we got to actually visit the clinics and hospitals in all the countries that we went to that we were going to partner with. And so to see how things were managed across cultures and across different countries. But then also that's a side of things that I don't really ever get involved in. So like for you, when we were going through the clinics for the mammography or for the mammogram machine, you would go in and say, where's the sheet that says that it was serviced last? And we were double checking everything. And you were showing, where's the cold chain for the vaccines? And you were showing me where, like if it had proper refrigeration in certain areas. And so it was really, really cool. That was such a cool learning experience on top of us meeting all of those amazing people while we were doing that. For me, it was so cool to be able to learn outside a bit more about how we're delivering the benefits holistically and what goes into the outside of the insurance plan itself. So I couldn't agree more with you.
Yeah, and you taught me a lot too. I remember you're a very good teacher. I don't remember exactly what the topic was, but there was some benefit financial thing that I just wasn't understanding. And, you know, you tried to explain it to me and I didn't really get it the first time. And then you sort of modified, you know, how it worked and explained it to me again. And then suddenly the light bulb went off. I'm like, oh, now I get it. And you know what? Not only did the light bulb go off on me, like I get it now, but I could see the light bulb go off on you, like, yay, I taught her this. So it was, I learned a lot from you also.
Thank you. Thank you very much. So I think you did a really good job of talking about your inspiration. I mean, everything lines up to exactly why you pursued the career that you did. I'm curious around, I know even when you left GSK, you didn't touch on that part, but I know you left GSK and it was similar to your role before P4P or before the Global Health Advisor role. You were managing the occupational health team within the US for another company, correct?
Well, yeah, I started managing the occupational health and nurse case managers, and then I got a promotion, and then I was also managing like the well-being team. So like the people who taught the
Gotcha.
corporate athlete. And then I also sat on the global leadership team in my second job. Unfortunately, COVID hit during that. So a lot of the focus went away from prevention of other things to prevention of COVID, which was very important, but not so much fun.
Yeah, sure.
Anyway, so that's right.
Sure.
So we've covered, you're right. We've covered that. And then I
Yeah.
retired. So we've
Yes,
covered
and then
that
you
pretty
retired.
well. Yeah. Yep.
Yeah, so like I was saying, you did a really good job of painting the picture around your career inspiration. I am curious around, so we got and also a clear kind of view of your career journey. Did you enjoy one side over the other? I know initially you said that you wanted to be able to practice medicine a bit more and to actually be hands-on with patients and helping employees directly versus when you moved into the P4P role. I know that project itself is rewarding, but the idea of helping to develop the benefits and looking at things from that side, what did you prefer one side over the other?
That's a great question. And I think it depended on the time of my life. I really feel so grateful in my career that I was able to do both. The nice thing about working with individuals is you get to know them really well, right? And I liked that. When you work with groups or large populations, then you're able to help a larger number of people. So there were benefits to both. It's really nice to help an individual and you really get to know them and their family and know exactly what they need and how you can help them, which is very rewarding. But it's also very rewarding to know that you helped, you know, hundreds or thousands of people as opposed to the one individual. It all matters. So I enjoyed both.
Okay, that's fair. So, and I'm not sure, you could take this out from whichever part of your career you'd like, but what would be something surprising about your roles in the past that other people might not realize as someone looking from the outside in?
So I think occupational health nursing, when people think of any kind of nursing or occ health nursing, they think of that hands-on patient care, right? Oh, I hurt my back. I go see them. They gave me my flu shot. Maybe they taught this class on nutrition. That's what they think of. What they don't understand is in occupational health nursing, you really have to have a good understanding of the business. And they don't realize that piece of it. In order to help the individuals and the population, you need to know all the different markets. If you want to start a program, you need to know how does that tie into the business's strategy and objectives. And you need resources for that program. So you need to know, who do I talk to and how do I position this to get the resources that I need to do for this program? So I think people don't realize that occupational health nurses really do need to understand the business and the market. So I think that would be the most surprising thing about occupational health nursing that people don't realize is that you have to have some business savvy and knowledge.
That's really good insight. So that leads me kind of to the namesake now, if I knew then. Is there a piece of advice that you wish you had earlier on in your career or personal life, and advice that you might share with someone, either your younger self or someone who's potentially looking to follow in your footsteps?
So I knew you were going to ask this because that's the name of the program. So I thought about it, and I actually have four, one personal and three professional.
Love it.
So we'll do the personal one first. I had mentioned, you know, my pup who inspired me to work in spinal cord injury. There's a lot of people in my life. He's one of them. And I'm sure a lot of people, we all have people in our lives who just give us unconditional love and are so good to us. And although he knew I loved him and I was there for him and I visited him, I never really showed him the love and appreciation that I should have. After he was gone, I realized, wow, he was so good to me. I should have showed him more love and more appreciation. And I should have asked him more about his career, kind of like you're doing on this podcast now. You're doing that. He had so much to give. And then I even think of, like my Nana, his wife, that again, I wasn't a bad granddaughter, but I wish I had visited her more and showed her more. And I can give countless examples. So my personal piece of advice is really recognize the people in your life who have loved you and helped you and nurtured you, and make sure you let them know that you really appreciate them. We often take them for granted, and their love for granted, and their advice for granted, whether it be your friend or your spouse or an aunt or uncle. So my personal piece of advice is really look at the people in your life who give you so much love, and make sure you give it back to them. Make sure they know how much you appreciate what you've done for them, because I look at where I've done a good job and I always could have done better. So that's my personal piece of advice.
I love that.
Thank you. My professional piece of advice, I have 3. The first might seem pretty basic and pretty obvious, but for those of us who didn't have it early on, it was life-changing. And to give you an example, when I was in nursing school, so I learned this in college, but it took me years to perfect it. But gosh, I wish I knew it in high school, and I wish I knew it earlier in college. When I studied or was learning a new procedure in nursing school, I did well on my exams. I did well when we had to do the laboratory, to practice something before we did it on a patient. But every time I had to do something on the patient for the first time, I would be so anxious and think, oh my gosh, I've never done this before. I'm not going to do a good job. I'm going to mess it up. So one time I had to do this procedure as a tracheostomy suctioning procedure. We won't get into the details,
Okay.
but it's an important procedure to do on a patient. I had never done it before. And I was anxious enough as it was. Well, not only that, but my instructor assigned me to do it on a physician. So if I didn't do it perfectly, he was going to know. And none of my fellow students had done it before, so she invited them all in to watch while I did this procedure for the first time. I was a wreck. So let's just say when I did that procedure, Anthony, it was not my finest moment.
Okay.
Somehow the patient got through it safely, but it wasn't pretty, it wasn't smooth, and I was not happy with myself. And afterwards, my professor said, how do you think that went? And I said, not well. And she said, you know what your problem is? Your problem is, she said, every time you go to do something new, you convince yourself that you're going to screw it up, and you proceed to do so. So she said, look, you have what it takes. We see your test scores. We see you in the lab. You're competent. You're very capable. You just need to believe in yourself. So that was a lightning bolt for me. And ever since that moment, whenever I go to do something new, instead of saying, oh, this is new, I can't do it, I tell myself, I can do this and I'm going to do it well. And you'd be amazed at what a big difference that makes. So any of your listeners who go into things thinking, well, this is only my first time, or I don't have enough experience, you really have to believe in yourself. And you're either going to do great or you're going to do better than you would have if you didn't believe in yourself. But if you go into it saying, I can't do this, I'm going to screw it up, you will. So my first piece of advice is believe in yourself. Monitor your self-talk and believe in yourself.
Absolutely agree. Great advice.
My second one is about networking. I really did not understand that. I remember we were in a meeting with some of our leaders, and they said to me one time, hey, you have that relationship with so-and-so. You should leverage that. And I was horrified. I don't leverage my relationships with people. That's unethical. That's phony. Now, if they had said to me, you should strengthen and deepen that connection and work with them to help them to understand what we're doing and how that benefits them and how they can help us, I would have said, great, I'm on it.
Mm-hmm.
That's really what networking is all about, right? It's like meeting people, learning about them and what they do, and teaching them and letting them teach you and making connections. That's really important. And it sounds silly, but I didn't understand that. I thought that was sort of a phony thing. Like when you're networking, you're not making a new BFF or going to bring them chicken soup when they're sick, right? I mean, it's not a personal relationship. I had to understand that, right?
Yeah.
But it's still a valuable, important relationship, and you can help them and they can help you. And you need to really intentionally build relationships, not just in your profession, but other professions, other departments, people of different cultures, people of different political beliefs or value systems. That's really important. You can learn from each other. And it's not a bad thing or a waste of time. It's a good thing. So I learned that a little late in my career. So I would recommend other people really build your network and understand it's not a phony thing or a bad thing. You need to understand the boundaries of those relationships and the goals.
I completely agree with you. Again, sorry not to hijack this, but you and I feel like we used to talk about this when we worked together, where I said I was like, I can't be fake. I can't do this. I've changed my mind. I think it had to do with my mindset, exactly how you said. If you can frame it differently and truly believe that the intent of what you're doing isn't fake and why you're doing it is this, it helps so much. So completely agree with you. I think that's fantastic advice. Sorry, go ahead. I know you have another one.
No, thank you. I'm glad. Yeah, we did talk, and I think you're really good at that. Like me, you and I, we're both very direct, right? That's why we work
Yes.
well together,
Yes,
and we're not
yes.
phony, and we don't like that. But you can have a good network relationship, and it's not phony, and it is direct, and it can be positive. You just need to, as you said, learn how to come at it from the right angle. And then the third one is about identifying and assessing barriers and potential negative consequences to whatever you're doing. Again, when we work together, we're both the type, if we're on a mission and we have a goal and we really believe in what we're doing, we are going all at it, right? And we're going to convince everyone of how wonderful this is. And it doesn't matter what the barriers are, we're going to overcome them. But I learned on that project that you really need to step back. And really, there's probably some unintentional negative consequences of whatever you're trying to do. And you need to actively elicit that information from the naysayers and from people. What could be bad about what I'm trying to do that I haven't thought of? Or, really those people who we sometimes find annoying who say, yes, but, and you can't do this because of this, and it won't work because of this, that we don't like to hear that. We actually need to hear that, right? We need to say to those people, tell me more about that. Instead of saying to them, wait, no, we'll make this work. And this is how. We need to say to them, that's a good point. Tell me more about that. Tell me more how that's going to be a problem. And let's figure out how we can get behind that. And even deeper than that, sometimes something that initially appears to be the barrier, oftentimes you need to look deeper and there's another barrier behind that. Like maybe someone's putting you off, and you think, oh, time is the barrier. They need more time. The barrier might be that actually one line item, that one cost item, they're not prepared to spend, but they don't want to tell you that. Or they think you're going to put them out of a job, or they just don't even agree with what you're doing. And they think this is, not worthwhile, but they don't want to tell you that. So identify the barriers, identify the potential negative consequences. And when you see a barrier, look a little closer at that. Is that really the barrier? Is there something behind it? And that kind of work that I learned actually in the project we were on has helped me tremendously. So that's my other piece of advice.
Those are all great. Thank you for sharing. And I completely agree with you. I think adding on to that would be, don't take it personally either. One thing that I thought was cool about here that I never was a part of, like in my role at Microsoft, was the team. I forget what they call it, but it's just you're looking for bugs. And you're actively looking for the thing that's wrong versus focusing on what we're doing right. And you're right. If you can look for those to start and understand exactly what the potential barriers are, the potential weaknesses of either your argument, your proposal, the project, you can better prepare for them and maybe avoid them to start altogether. But then don't take it personally if they still come up and if you can't get past it. So I completely agree with you. All right. So those were fantastic. I love it. What's next for you? I know you're retired. I know you're doing some traveling with your husband. What's next?
So I have a few things. One might surprise you. It'll probably take me years to complete it, but I have a few ideas for books I want to write, and I'm actively working on a book now. And I have several ideas, but the big one I'm working on now is a spy novel.
Okay.
I love to read about spies, whether it be fiction or real life. So I read so many of them that I want to write my own. And I have other ideas for books, but yeah, I want to write a good spy novel.
Oh, I love that.
Yeah, it has nothing whatsoever to do with my career. It's just, using some my creative skills, which I didn't have as much of an opportunity. So I'd like to write a book. I have several ideas, but that's the one I'm kind of actively working on. As you said, travel. My husband and I have a camper that we bought, and we are traveling the U.S. and we're loving it. We're seeing national parks and state parks, and we have such a beautiful country here. You and I did a lot of international travel, and there's a lot of value in that about learning learning about other cultures. But there's so much great things here in our country,
Yeah.
and Canada's easy to travel to. So, and it helps us to work together as a team. So we have our camper and we're traveling around the US and we're visiting, everyone thinks of the national parks, but they should, if you're traveling, look at the state parks too. There's some really beautiful, beautiful state parks. They're hidden treasures. So yeah, hit the national, but hit the state parks too. I'm doing that. And I'm also planning, this is a big challenge, just came up in the last 2 weeks. I was invited to join a women's cycling tour. It's a small group of women and we're going to cycle for a week around Quebec and Nova Scotia area
Wow.
around Canada. And that'll be a big challenge for me because the other women are much better cyclists than I am. It's next summer, so I really need to train for this. So it'll be a nice challenge for me. I got to get on my Peloton and get on my road bike and really train for this. So they're not career things, but I had 36 years of my career and I loved it. And I really gave my heart and soul to it. And I don't regret any of it. I mean, there's mistakes, there's things I wish I had done better, but I love every job I had, the career that I had. And so now I'm just looking to do entirely different things. And I'm loving
Love
that
it.
too.
Love it.
Mm-hmm.
I hope you continue to enjoy a well-deserved retirement. Thank you very much for doing this. You were fantastic. I think the advice you gave is awesome. I think it's going to resonate. I know I said this to you before, but you and I think we always got together because we were similar in the sense that we were both very direct, but we were good with being able to have the conversations with each other. So when we were traveling, we're like, hey, can we just get a day with each other? You also put up with, at that point, I still remember when we were in Australia and we were going to do the wine tour and I insisted on not doing the group one that they had. I thought we were getting a private tour. We ended up spending like 10x and it just happened to be a driver who took us to the places and it wasn't a tour at all. So you were awesome to travel with. Thank you for always being an ear for me and someone to lean on during my time at GSK. I really appreciate it. I'm glad that we're staying in touch. So thank you so much for doing this. I'm really happy that I could have you on.
Well, thank you for having me on. And one of the things I wanted to mention when we traveled together, you encouraged me to do things I wouldn't have done. You got me on a hoverboard, which I never would have done. Remember that?
I forgot about that. Yes.
Yeah, I never would have done that if I didn't know you. And you also had me, we were in Vietnam and our colleagues said, we're going to go do karaoke. And I said, I don't do karaoke. And you said, Donna, we're in Vietnam. You're doing karaoke. So you really got me to do some things that I never would have done. So thank you for that. I learned a lot from you professionally, and I had some really fun experiences traveling with you personally. So you've really helped my growth, and thank you for that. It's been a pleasure watching you grow, and of course your wife and your children and your family. I wish you all the best.
Thank you so much, Donna.
Thank you, Anthony. Bye.